Hey guys, Kalen from Holistic Foot Clinic, and today I'm going to be talking with you about dermatological issues, otherwise known as skin and nail problems of the foot. At least when it comes to podiatry, that's our main concern with dermatology. Over this series of videos, we're going to be talking to you, today at least, about types of skin conditions and what they might look like. And then in future videos, we're going to go over treatments we can do for you in clinic to help ease your problems, long-term ways that you can manage these issues, and then maybe go over in the last video a few interesting cases that we've come across. So, when we're talking about skin on the feet, and really it comes across in the hands often as well, we're going to talk about calluses, corns, warts, cracked heels and dry skin, tinea or athlete's foot, dermatitis, and very occasionally we come across some ulcers. Callus is pretty much hard skin that layers on, and this is usually in response to pressure or friction. People who tend to do a lot of work with their hands might notice a little buildup of yellow, hard, dense skin. And this can sometimes not be painful at all, but often on people's feet tends to cause a lot of problems. When this hard skin becomes very dense from a lot of pressure, generally from people who stand on their feet all day, it can sometimes go into a bit of a cone shape, and that's called a corn, which effectively you can imagine like something of that shape poking into your foot, can cause a lot of pain for people. This can be confused sometimes with warts, which again can make a bit of a lump and focus part of hard skin on the foot, although this is usually, in response to a virus, which creates a lesion on there. Lots of people get warts, generally children. If you have children or when you were younger, if you remember having a wart on your hand or your feet and you've had it dealt with, you know that warts can generally be dealt with within a reasonable time, and then they might not come back for many years if at all, whereas corns and calluses tend to hang around for a bit longer. Now, coming in summer as we are now and people are wearing too much of these, cracked heels and dry skin are very common. Sometimes they can range from very mild and not too much of a problem to, of course, when people have big cracks in their feet, a bit like a desert, and they can even bleed and of course cause a lot of pain. Of course, shoes and moisturizers can make a big difference to how you deal with this, but we'll go over other things that we can do for you in clinic in future. Now, in terms of infections or odd presentations on the skin that irritate people, tinea, athlete's foot, fungal infection, 3 terms for the same thing, very common that we see in clinic. And you can have any number of symptoms, even just 1 or 2, but generally there will be some amount of itching, redness in the area, little red dots, peeling of the skin, blistering, dryness of the skin. There are so many symptoms that come along with tinea, but really you only need 1 or 2 to kind of get an idea that that's what's going on. And it is relatively manageable in most cases. Dermatitis, which can include eczema or psoriasis, is something that pops up for a lot of people, and sometimes it can be hard to tell whether you're looking at something like an infection or a condition like that, which is your own body's reacting. Ulcers are something that can happen when someone injures themselves, the skin breaks open, and has a bit of trouble healing back up, in which case you're generally looking to have it treated with possibly some special care, removal of dead skin in the area, and special dressings for wounds. When you're talking about nails, often a lot of people just come in because the nails are too thick and long, and they either can't reach them or the odd original nail clipper at home isn't going to do the job. Ingrown toenails are probably the most common reasons people come to see us for nail pain. Obviously you've got your finger there, or your toe in that situation, the nail creeping over, and just like the corn, something sharp poking into you. You might have bleeding, you might not, might have infection, you might not, but it's a problem that generally people need to sort pretty quickly. Otherwise, when it comes to nails, often you'll see odd shapes or colours, and this can come across a range of issues, from fungus to just someone having kicked their toe. Sometimes they don't even realise it. Sometimes there's nutrition or medication side effects and issues, and sometimes there's underlying health conditions, which obviously can be a bit more serious than just an infection or injury. For all of these issues, there's a good reason to want to have a look at what's going on and figure out what is the main problem that is causing these issues for you and what needs to be dealt with. We're going to go in further videos, as I've said, into then how we can actually treat these cases and ways that you might be able to manage them at home yourself. Until then, take care everybody. Keep on walking. I'm Kalen from Holistic Foot Clinic.